Angie Gallagher and Molly, they do need some specific exercises to help them heal.
Yeah, there are, Steve and Katie. You know, when a breast cancer survivor kind of leaves the hospital or finishes treatments, there's not really a national prescription that the doctor gives them. But the Pink Ribbon Foundation is the prescription that trainer Angie Gallagher has been trained in, and she helps her clients post-breast cancer treatment, post-breast cancer surgery. We're here with Marlene Siegel. She is a breast cancer survivor. So good to have her with us this morning. You wanted to talk a little bit about the surgery that you had.
Yes, Dr. Lekas brought the DEEP procedure to Central Iowa. I was the first one, and the important thing is you retain your stomach muscle. But there are many women that have not had it, or in the past 15 years have had other procedures, and that's why Angie's so important, is she individualizes instruction in the Pink Ribbon program.
Yeah, so she knows how to get you moving again. Mobility is very important. So Angie, when you work with the woman who comes to you, you said you just want to get them moving again and the confidence going.
Their self-esteem, their confidence, and their anxiety about their loss of range of motion and loss of strength that they have, and being able to get that back is a tremendous help to them.
Okay, let's show people a few exercises that you do with your clients.
Okay, first of all, we're going to do an overhead stretch. So we're going to lay down on our backs and our palms are going to be down. Let's just do the T position first. We're going to take it by our side with our palms down, out to the side carefully, yep, with the palms remaining down. Shoulders are retracted down against the ground. And then we're going to take our palms up, and then we're going to carefully continue going up overhead as far as you personally can. Not everybody, so we're going to slide it along the floor. Along the floor, there you go. So not everybody's going to have that range of motion right to begin with, but that would be something to work for with that range of motion. Then bring it back down, turn the palms down, and take it back down to our side. So that's an overhead stretch, another beginner move. Secondly, we can do an overhead reach, or circle is what they call it. So your palms are now going to come up towards the ceiling. Yep, and our fingertips towards the sky. Now we still want to keep our shoulders down, retracted against the ground, and then carefully let those go overhead, reach up overhead, but keep the shoulders away from the ears. So go ahead and reach away. There you go. Again, range of motion is going to vary from individual depending on their treatment and what they've had done, and then bring it back. But eventually we want to get to the point where we've got that range of motion back.
Great, that's the most important thing. If you're out there and this seems like something that you need help getting that range of motion back, you can talk to Angie at fitnesswithangie.com. Steve and Katie.
Right. This is on exercises for breast cancer survivors. Molly Nelson is live in Urbandale with trainer Angie Gallagher. And Molly, you have specific exercises for breast cancer survivors, correct?
Yeah, Steve and Katie, there's some things that they can specifically do post-treatment or post-surgery to get them moving. We've got a very special guest. First, let's just talk real quick with Marlene Siegel. And Marlene, they didn't have the Pink Ribbon Foundation when you were going through treatment, but you do know the value of exercise post-breast cancer surgery.
Oh, it's a stress reliever. It's great being with other patients that have had different surgeries or chemo, radiation. So positive. And now that Angie started this certified in the Pink Ribbon program, it's great, and people really need to look into it.
And Marlene is a breast cancer survivor. She looks amazing. She works with Angie. Angie, you've been trained in the Pink Ribbon Foundation. Tell people briefly what it is.
Well, it was established to give specific exercises to women that have been affected with cancer, and it really helps with their range of motion, increasing that again and getting their strength back.
Okay, you're going to show us a few of the exercises. You've got a microphone on. You didn't need both of these,
okay.
But show us a few of the exercises that you work with your clients.
Okay, well, this would be, we're going to show progression. So it does have about 3 phases, from beginner to more advanced, to kind of ease you back into a traditional exercise program. So I'll show you the beginner move of a mermaid without any use of props. We're going to lean on the one hand as you've got set up already. Our legs are out to the side. Take our hand gently up and over just to where your range of motion allows you to go, and then you would return it back to start position.
So the area most affected is kind of in the shoulder area?
Yes, so we're trying to keep the shoulder down, the scapular region, which is behind here. Try to keep that down and away from your ear while you're doing this. So it's a great stretch. Okay. Good job. So to add a little bit of intensity, a little bit more range of motion to this move, once you get to that point, you take a band, you sit on it, and with that same hand, you're going to reach again, and now you've got a little bit of extra resistance to help facilitate that stretch.
Okay,
so it would be a good progression.
Good. This is a lot of good information. There's some people out there obviously probably affected by breast cancer surgery, breast cancer treatment. If you want to talk to Angie about getting fit again, call her or go to her website, fitnesswithangie.com. Stephen